When I was a student, I got for Christmas a book called 101 Things a Boy Can Do with Chemicals. In the country town that I lived in, the pharmacy was the only source of those chemicals. I thought, this is, fun thing to do, to be able to mix things and create things. By the time I actually started pharmacy, it had become a 3-year full-time course. And it was a time when of 100 students who might enrol, less than half of those would actually complete the course in the 3-year minimum. And in fact, as many as 40% would drop out in that first year. It was a difficult course. The colleges employed Dr. Anne Stafford, who was the first real researcher to come into the Victorian College of Pharmacy. And at that time, Barry Reid was a senior demonstrator, and he was setting up a research project, and I sort of wheedled my way in there. And so between us, we then started on a journey that took us from experimenting with fish to developing cell culture, to later on looking at delivery of things through the skin. I did my undergraduate degree here, I did my graduate degree here, then I came onto the staff, and I was here for my whole career. And so the changes that occurred were, I evolved with them. And I'd like to think that I was part of having those changes take place. I think one of my proudest things is the students that I've had the fortune to supervise along the way. Originally, funding for research here that we had was partly through grants given to universities that were, the university then chose what they funded. The funding then started to come from grants from non-profit organisations, government organisations that were competitive grants. That changed the direction of research. The universities started to reach out to the industry. You were more likely to attract funding from the industry if somebody could see an application or commercial use for the work that you were doing. When we started to work in drug delivery through the skin, all of a sudden you can see, this might have some potential for producing advancement in products that somebody can commercialise and sell. We had products that were approved for use in the US. Barry Reid, if Barry hadn't been here, I wouldn't have done anything. There was a recognition that what we were doing was world-class research, and we were supported by the various deans and heads of department. Like a lot of things in research, there's no eureka moment. That what happens is largely by serendipity and a whole series of coincidences. While I'm not active in research, I'm still sort of being the old head and giving advice to people who are in that phase, and particularly with the experience of commercialising the technology that we did. That's quite satisfying to see somebody else succeed.